For my FRED talk, I'm going to talk about Alzheimer's disease. The reason why I decided to talk about this disease is because my grandmother developed Alzheimer's a few years ago. What is Alzheimer's disease? Alzheimer's disease, also known as senile dementia of the Alzheimer's type, is an incurable disease and that occurs in people around the age of 65 where the brain has deteriorated. Due to the loss of mass, it mainly causes loss of brain function in the areas of memory, thinking, and behavior. When a person under the age of 65 develops symptoms of Alzheimer's, it is known as early onset Alzheimer's. Of all the people with Alzheimer's disease, only 5 to 10% develop symptoms before the age of 65. Alzheimer's is the most common type of dementia, where as many as 5.3 million people in the United States are living with Alzheimer's. The number of people aged 65 and older with Alzheimer's disease is estimated to reach 7.7 million in 2030, which is more than a 50% increase from the 5.1 million aged 65 and older who are currently affected. By 2050, the number of individuals aged 65 and older with Alzheimer's is projected to number between 11 million and 16 million. In this map of the United States in 2000, it shows the amount of Alzheimer's cases during that time. States like California, Texas, Florida, Illinois, New York, and Pennsylvania have the greatest amount of cases for Alzheimer's. States in the Midwest have the least amount of cases. When you look at the cases in the United States in 2025, there are significant increases in many of the states of cases in all the areas of the United States. Symptoms of Alzheimer's. Alzheimer's disease affects a person slowly, and there are signs and symptoms that may determine Alzheimer's in someone. Early symptoms of the disease include difficulty remembering new information, confusion, disorganized thinking, impaired judgment, unsafe wandering, and disorientation of space and location. Risk factors. The first risk factor is age. Age is one risk factor for Alzheimer's disease where your risk increases. However, Alzheimer's disease is not part of normal age in everyone. The second risk factor is linked to the apolipoprotein E gene, which is on chromosome 19. Having the certain combination of genes for proteins that appear to be abnormal in Alzheimer's disease increases your risk. Thirdly, having a close blood relative such as a brother, sister, or parent who developed Alzheimer's disease increases your risk. High blood pressure and history of head trauma also increases your risk. Lastly, females are a risk factor where women more frequently develop Alzheimer's than men. Data from women aged 71 and older had higher rates of developing Alzheimer's than men, with 16% for women and 11% for men. The 2008 estimate is that 2.4 million women and 1 million men aged 71 and older have dementia. The brain. The cause of Alzheimer's is not entirely known, but is thought to include both genetic and environmental factors. A diagnosis of Alzheimer's is made when certain symptoms are present, and by making sure other causes of dementia are not present. The only way to know for certain that someone has Alzheimer's is to examine a sample of their brain tissue after death. Also, looking at the brain, you notice the amount of brain substance in the fold of the brain is decreased, and the spaces in the folds of the brain are grossly enlarged. When nerve cells or neurons are destroyed, there is a decrease in the chemicals that help nerve cells send messages to one another. As a result, areas of the brain that normally work together become disconnected. There are different changes in the brain that can be seen with a patient with Alzheimer's. The neurofibrillary tangles, the neuritic plaques, and the senile plaques. The neurofibrillary tangles are composed of a protein called tau protein. Tau proteins play a crucial role in the structure of the neuron. Neurofibrillary tangles result in the death of the cells. The brain of a person with Alzheimer's contains abnormal clumps of cellular debris and protein plaques and collapsed microtubules. Fatality. Alzheimer's is the 7th leading cause of death in the United States. In the chart, it shows from 2000 to 2006, Alzheimer's had the greatest increase in fatalities compared to the decreasing amounts of fatalities with heart disease, breast cancer, prostate cancer, and strokes. In a 2004 study, the average survival time after a patient being diagnosed with Alzheimer's disease is 4 to 6 years. Prevention. According to the recent Mayo Clinic review, no single lifestyle choice has as much impact on aging and Alzheimer's disease as exercise. Exercising or working out for at least 30 minutes 5 times per week can reduce your risk for Alzheimer's disease as much as 35%. A healthy diet is also an important factor in prevention for Alzheimer's. The American Academy of Neurology recently warned elevated cholesterol in your 40s increases your risk for Alzheimer's. Stimulation of the mind decreases the odds of developing Alzheimer's. Strategy games and puzzles are good mental exercises and can help build your capacity to form and retain cognitive associations. Doing activities such as reading a book, learning a new language, or completing creative challenges uses both sides of the brain. Those who remain engaged in activities, including communication, interaction, and doing multiple tasks, gain the greatest protection in challenging their minds. Getting regular amounts of sleep also help to process and retain information in the brain. Poor amounts of sleep can significantly damage your brain and central nervous system. If nightly sleep deprivation is slowing your thinking and affecting your mood, you may be at a greater risk for Alzheimer's disease. Minimizing stress is another important tip. The harmful stress hormone cortisol affects nerve cell growth and connection and accelerates cognitive decline, premature aging, depression, diabetes, and other harmful effects on your brain. Did you know smoking after age of 65 increases your chances of developing Alzheimer's by 79%. Obesity in midlife makes you 3.5 times more likely to experience Alzheimer's. Diabetes makes you twice as likely to develop Alzheimer's. Genetics account for only 25% of Alzheimer's cases, and chronic stress may quadruple your risk. Treatment. There's no cure for Alzheimer's disease. Most of the drugs that are used for Alzheimer's patients are aimed for slowing the rate of symptoms, but not actually treating the disease. The benefit from the drugs is usually small, and patients and their families may not always notice much of a change in their symptoms. Many treatment options for Alzheimer's are experimental drugs. 2 drugs that are used for treating symptoms are memantine and donepezil, which both are risky because they have different side effects. Concluding on treatments for Alzheimer's, my grandmother has taken several different kinds of experimental drugs, but no change in her memory has been big enough to notice. Over the past 4 years, my family has noticed the increased decline in her memory. Thankfully, she still has long-term memory, but her memory span for retaining new information is about 2 minutes, where daily tasks need to be constantly reminded to her, like eating meals and taking showers. This disease is stressful for everyone in the family, but all I can do is cope and accept her behavior because her memory loss is not her fault and only the disease affecting it. That's it.